friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you. Welcome to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, physical therapist and owner at Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now Dorado, Arkansas. If you remember last week, we were very privileged to have Dr. Rachel Atkins here. She's one of our staff therapists, and she specializes in pelvic floor impairments. Now, if you remember last week, she talked about stress incontinence, and she'll give you a quick review of that. And then today, she's going to be focusing on urgency incontinence.
That's right. Yes.
All right, Dr. Rachel.
Correct. Yes, last week we talked about stress incontinence, which is where a stressor causes you to leak urine. So that might be when jumping, lifting, laughing, etc. Urge incontinence is different because it's the urge to go and you're not able to hold your urine. So when you feel like you've got to go right then, and if not, you have an accident or some leakage. And so a good way to tell if you have urge incontinence, or sometimes referred to as overactive bladder, would be to know how often you are urinating. A normal urinating schedule would be once every 2 hours, and at night no more than once to twice a night getting up to use the restroom. So if you find yourself leaking when you feel the urge to go, or with an overactive bladder having to go more than once every 2 hours, then you likely have urge incontinence. And I do want to encourage you to be sure that you're speaking with your medical doctor about this issue if you do have it. And I'd like to next tell you more about what to do if you find yourself struggling with urge incontinence.
All right, so come back in the next segment, and that's what Dr. Rachel will teach you how to do. Thank you. Welcome back again. I'm Dr. Jerry Yarborough, physical therapist, owner of Physical Therapy and Balance Centers. And today we have a special guest, Dr. Rachel Atkins. She is one of our staff therapists that specializes in pelvic floor impairments. And she's going to be talking further about urge incontinence and what you can do today to help improve your situations.
That's right. So in order to help improve your ability to control your bladder when you feel the urge to urinate, there are 3 tips that I'd like to share with you today. The first tip will be to avoid intake of irritants to your bladder. The second tip will be how to use a schedule for your bladder control. And the third tip are some actual exercises that you can use to help improve your bladder control. And so avoiding irritants would be making sure that most of your liquid intake is water and avoiding particular irritants like caffeine, sugar, artificial sweeteners, sodas, coffee, alcohol, that kind of thing. The second tip is to get on a bladder control schedule. What that will look like is when you feel the urge to urinate, you try to work your way up to going 15 minutes before using the restroom. So when you feel the urge to urinate, you're going to do the exercises that I'm about to tell you about in order to control that urge for up to 15 minutes. And another thing on the scheduling of the bladder that's very important is not going just in case. You must retrain your bladder, and that involves the muscles and the mind. So it's mind over bladder, making sure you don't go if you don't have to go. The third thing are the actual exercises that you can use in order to work your way up to those longer increments of not going to the restroom. When you feel the urge to urinate, you can do several things. A few of those are ankle pumps, so pumping your feet up and down, and you can do this in sitting or standing. The second is deep breathing exercises. Put your hand on your belly and breathe into your hand and out, and continue that for several minutes. And the third thing you can do is make sure that you're sitting down on a firm surface, applying pressure to the pelvic floor to help control the bladder. So those are 3 things that you can do as far as exercises to control urgency and prevent bladder leakage.
All right, that's awesome. That's I even learned something there. You know, like our kids, we teach, now go to the bathroom before we leave, just in case.
Yes.
And you know, I too still practice that. You know, going on a trip or whatever, I go just in case. So
Exactly.
I've been training my bladder badly, right?
Exactly.
So we need to cut that out.
Right.
And anyway, I really appreciate you coming and sharing that with our viewers
I'm glad
today.
to.
And again, this is Dr. Rachel Adkins. She is our pelvic floor specialist here at Fyzical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana. And we would love to help you improve your quality of life. Remember, our motto is that we're here to help you love your life. And our name is spelled different because we are different. So come back next week, in which Dr. Rachel will be talking again about other pelvic floor impairments.